Good evening, everyone. This is Dr. Weaver, and I am going to discuss with you today um, budgeting, budgeting basics for nurses. Um, this particular discussion is one of two topics that we will be responsible for knowing in this. What are we in the eighth week? I believe we're in the eighth week. And I think the other discussion deals with teams and conflict and so forth. And so that is what we'll discuss in class, of course. But even that, I'm going to try to make a voiceover for like the last maybe 15 slides or so that we can have hopefully a meaningful discussion when we come to class on this coming Friday. All right. So we're going to be talking about budgeting. I know this might be a very boring topic for some of us. For me, I love it because I think that when you know how to manage, your monies, when you know how to manage your resources, life is it becomes that much more easier. All right. Um, when you think about budgeting, you probably say to yourself, "Well, shouldn't isn't that something that the nurse leaders will manage? The nurse manager for the floor, the director, whatever, wherever they are in that hierarchy." You figure, well, that's their problem. It has nothing to do with me. And of course, budgeting has a whole lot to do with all of us. When you understand this basic budgeting, and this is a very basic introduction into budgeting, um, and when you understand just even the basics, it helps you to also understand why the hospital do what it does, why the managers do what it does. For example, why don't we have enough staff? How come there's limited resources? How come they're limiting overtime and so forth and so on? It just helps you to understand the background as to why um, you know business is carried out in the way that it is, day to day, week to week, month to month, and even year to year. Um, and also the way I look at it is I look at it from a personal perspective. Um, you know, um, uh, well, we all will be applying these concepts in some kind of way as far as budgeting as we work in the healthcare setting. But I guess what I'm trying to say is even if you take this information and apply it to your own lives, there's just a lot that you can learn from a course or from this topic, in other words, and just apply to your life again to make your lives a whole lot easier, and so you're not broke all the time, right? So that's the way I look at it. There are plenty of courses that we actually take in nursing that can be applied to our personal lives. Think about psychiatry. You get to learn about a lot of the people in our society. Those who are experiencing psychosis, schizophrenia, and depression, right? And so you get to learn, in other words, about human nature, if you will. You think about health promotion, right? I've taken a lot of what I've learned about disease processes and health promotion, and what can I do to keep myself happy, healthy, rather. So there's so many things that we learn from the various courses that we take in nursing that can, help. It can be applied to your lives, and it makes our lives less problematic, if you will. So, so if you can look at it from that perspective, then hopefully you will see the benefit of learning these types of things. It's not so much or all about learning about the disease processes and med surge and pharmacology and all these clinical related courses. There's a lot of other pertinent uh, um, things, information that we need to learn regarding nursing. All right, it's just as important. So anyway, let's go ahead and let me see if I can go ahead and share my desktop. This is a little different for some reason, and I don't know why. Oh, here it is. Let's see. I'm going to share here, and I want screen 2 and allow. All right. All right, so hopefully you guys can see what I'm sharing over here. Let me go ahead and open up my presentation. All right. All right, let's go ahead and get to it. So this is chapter 18. Again, budgeting basics for nurses. Again, as I said, this is really basic. Of course, if you guys ever become a nurse manager, a nurse leader, whichever direction in nursing you decide to take, of course, there's always staff development and other courses. Other trainings or whatnot that you will get, and it would be, of course, more comprehensive. Now, the budget serves as the financial guideline that allows a healthcare organization to achieve its goal of providing high quality patient care services. I mean, if we don't have if we don't budget properly and the resources are not there, we won't be able to provide the great care that our patients deserve. Now, just as nurses learn about clinical guidelines for the care of patients with a variety of diseases, it is also needful for nurses to have a working knowledge of the guidelines that ensure that an organization is able to operate in a stable financial environment, and this is through effective budget management. All right. Now, well, additionally, I should say that the focus on cost and quality initiatives today in today's healthcare settings requires that even staff, nurses, have a basic understanding of the budget. And I gave you some examples about that earlier. It is you'll see that your nurse leaders are making certain decisions, and in your mind you're thinking, well, why are they doing that? Why is this so important? How does this even relate to patient care? But as I said, as we go through this presentation, hopefully you will be more enlightened and will understand more of what is the method to the madness, as you have heard in the modern vernacular. Now, these are the objectives. Go ahead and take a look at that. All right. So as a nursing student, you are probably more aware of budget concepts than you realize. So what I would like to do is to give you an example of how you guys budget as students, and then I'll compare that to how the budget is managed for a business or for the hospital, if you will. And hopefully you'll be able to see that you're basically doing the same things, but yours is more personal versus the hospital is more of a business, of course. So think about this. When you decided to become a registered nurse, you had a goal to graduate from nursing school within a certain period of time. You had to make a budget plan by predicting what your expenses for that period would be. For example, your tuition, your books, and also living expenses. Now, you also predicted your revenue from sources such as student loans, part-time jobs, whatever savings you have. whatever parental support you might receive, as well as spousal support. And in terms of these revenue sources, think about with hospitals, they depend on Medicare, Medicaid, private insurances, private pay. So this is how hospitals depend on their revenue. But in your case, of course, I gave you the types of revenue sources that might be available to you. Now, after predicting your expenses and your revenues, you most likely planned your budget for how much you could spend on a weekly or even a monthly basis during this time, and eventually achieve your goal of graduating from nursing school. But remember, you had to manage those resources. Now, when you think about a healthcare organization, all right, a healthcare organization develops budgets for a specified period by determining what their goals would be, what they want to achieve. They predict their expenses, what their revenues are going to be, then planning the annual budget and monitoring their budget on a monthly basis. All right. For example, a hospital may plan its annual budget to maintain staffing and supplies to operate its current number of beds, provide a raise for all staff members, and also open up perhaps a new chest pain center or something, that they would like to do. Now, basically, the healthcare organization's budget is a document. It's a living document, actually, that details how financial resources will be allocated to ensure that the organization is able to conduct its daily business and to achieve its strategic goals. All right. Now, the budget itemizes the organization's predicted expenses, what is going out, and also what they will be making, their revenues for a given period of time. Now, more importantly, budgets require ongoing attention. As I said, it's a living document. They require this ongoing attention in order to ensure that the organization's financial needs are met. You don't want to run out of money as an organization, because then, of course, you cannot provide safe care and safe and effective care for our patients. Now, just as nursing students most likely have to make decisions to adjust their budgets during nursing school to meet unexpected changes in revenues or expenses, all right, the healthcare organization invariably experiences the same challenges during the year as well. Maybe a machine may break down, a very expensive machine, mind you. Maybe they will have a call out or something. Maybe they have more overtime than they anticipated. I mean, and the same with us, of course, as students and whatnot. Life happens and whatnot, and of course, our budget will have to be revised, and that's why we are constantly being vigilant and looking at our budget, making sure that we can go the distance, right? So again, so this budget, it becomes a dynamic action plan that basically guides the allocation of resources and expenditures, and also influences the manager's decision making on a day-to-day basis, sometimes on a week-to-week basis, and also on a month-to-month basis. Now, budgets perform four basic functions to make certain that the organization can achieve its strategic goals, and also ensure continued operations from an economic standpoint. Now, the four budgeting functions that we will speak about in more detail will be planning, all right, coordinating and communicating. The third one is monitoring progress, and the last one is evaluating performance. So the first one we will talk about is planning. So planning is the most important function of the budgeting process. During the planning phase, managers first decide on the goals to achieve for a specified period and identify whatever the resources are. The resources can be staff, all right? It might be supplies or other equipment that is needed in order to achieve those goals. And of course, all this costs money, right? Next, they predict what the revenues they might make for that period, as well as your expenses based on those goals, and then develop budget assumptions to use in planning the budget. Now, budget assumptions allow the managers to answer various questions that will have an effect on the budget, such as, for example, what should nursing salaries be in the coming year to remain competitive with other healthcare organizations in the area? Also, how will services that are being offered by other healthcare organizations in the area affect your particular organization? Because you as a manager or as a healthcare institution, you have to be competitive with other healthcare organizations, benefits, pay, if you will, even working conditions. Otherwise, people will leave. Now, budgets are most often developed for a 1-year period on the basis of predicted amounts of services that will be rendered during that period. So, for example, hospitals predict patient census and the related revenue that will be generated by providing services for those patients. And then they allocate those funds for nursing salaries based on the predicted census. So as you can see, the census has a lot to do with, of course, the monies that we will be able to make. All right. Now, historically, nursing has had limited input into fiscal or financial planning and development of the organization's budget. Administrators with no clinical background and, of course, very little understanding of nursing values, beliefs, and care requirements traditionally made decisions about resource allocations related to nursing. In other words, these administrators, these leaders were so far removed from where the actual work is taking place, and they're making these types of decisions. And they apparently over a period of time begin to realize that you actually need someone with some clinical knowledge and experience, to have their input into this decision making. Now, today, participating in the budget process to determine resource allocation, it is a fundamental responsibility of nurse leaders, right? We're closer to the work. We know more about it than they do, right? Right. So involving staff nurses they also involve staff nurses in the budgeting or the budget planning, which is highly recommended. Managers and staff who participate in budget planning are likely to be more cost conscious and appreciate how their units should function to meet the overall financial goals. And so again, including the staff along with the manager, of course, this is the best way to come up with a more viable, a more comprehensive plan that would be more meaningful. All right, and so the next one is coordinating and communicating. Although not commonly associated with budgets, coordination and communication are very important functions of budgeting. Now, the budget process, by necessity, requires that many different groups within an organization come together to discuss the resources necessary to accomplish the goals of a business unit. Therefore, one can think of the budget process as the best opportunity to discuss concerns about resource allocations with the organization's leaders who are capable of resolving issues. All right. And of course, folks from different areas, from accounting, nursing, and otherwise will be involved in this discussion. Again, it just allows for more available information so that those decision makers can be well informed. And so their decisions would be more congruent with with the reality of what is actually happening at the bedside, if you will. All right. As far as monitoring progress, monitoring progress rather is one of the most vital functions of the budget. You just don't make a budget, walk away from it, and then, of course, don't pay it any more attention. It must be an ongoing monitoring, right? This is the function that the nurse manager is most involved in on a daily basis, which is why you see those nurse managers out on the floors. They're looking at things, they're talking to people, they're trying to determine what is what in order to continue to make those revisions, those adjustments to the budget. Now, it is through the comparison of actual financial performance against what is expected or budgeted for performance that an organization measures the effectiveness of its budget, right? Because some of this or part of the budgeting is expectations and whatnot, or forecasting, if you will. And the closer the nurse leader can come to that, especially if you're operating under a certain budget, it just shows how much more effective that individual is. All right. Now, ongoing monitoring of the budget allows timely corrective action because you're constantly watching what is materializing over time. If the budget plan is right on target, then the knowledge that no adjustments are not required, which can be a good thing. Now, the difference between the planned budget and what is planned versus the actual results is called variance, right? A variance is favorable when the results are better than expected, right? When you come under budget, if you will. But it is considered unfavorable when the results are worse than expected. In other words, you're spending way more than what is expected or forecasted. All right, and they refer to that as a variance. So it's a favorable variance, and there's an unfavorable variance. Now, the lower than planned revenue in the chest pain center is an example of an unfavorable variance. They didn't make as much money as they thought they would make. All right. Now, there's also a variance analysis. All right. This is the process by which deviations from budgeted amounts are examined. All right. It has to be analyzed. Why is there a deviation? What could we have done better? How could we have planned better? And so forth and so on. And then, of course, we have evaluating performance. It's just like the nursing process. You assess, you plan, there's the intervention, and then you evaluate, and then you revise. All right. But it's that continuous assessment. But you have to evaluate what you have done to determine if it was effective, right? So budget results can be used as a part of a manager's evaluation and may include a staff bonus structure. right? Especially if we've done well as a unit. Budget results can be used by evaluators to determine a manager's overall success in achieving goals. All right. Nurse managers are frequently evaluated um, on basis of or they are frequently evaluated on their effectiveness in managing nursing overtime costs and supply use, both reflected in the nursing unit's budget. All right, so that can make the nurse manager look pretty good if they're managing both very well. Now, performance evaluations based on budget results can motivate managers to effectively control budgets. All right. Sometimes, well, when I was in the clinical setting, remember I told you guys that in order to determine how many nurses you need for a given unit on a given shift, we use an acuity a tool, and this acuity tool tells us whether you need maybe 5 nurses versus 7. The greater the severity of illness or complex patients, then the more nurses that would be required. And the reason I mention this is because if the acuity is only calling for 5 nurses, I will tell you that sometimes nurse managers, 4 o'clock in the morning, they call the charge nurses and say, how many are we supposed to have? And then the charge nurse or the team leader says we're supposed to have 5. But then the nurse manager realizes that, but you have 7. You have 7 working, but it only called for 5 nurses. And believe me, they really wring their butts when they are not staffing the unit according to the acuity, because that's extra monies that is being paid out. And you probably really needed the nurses and whatnot because there are other circumstances that may call for it. But sometimes they can be very rigid when it comes to that acuity system and the amount of staff. Remember, staff is one of your biggest overheads. All right, that's where a bunch of your expenses are going to. Now, even though the manager maintains ultimate accountability for the unit's budgetary performance, lack of staff ownership of and involvement in the unit's operation usually leads to problems for the manager. So basically, we all are involved in this process. The nurse manager, the team leaders, and the staff. We all have to be involved and accountable. And this usually leads to success because we're doing it together. All right. Let's see, budgetary involvement. All right, so we did that. This should not be a very long presentation because there's actually only 20 slides. But I figured this was the one I wanted to actually do voiceover on because I can get through it fairly quickly. All right. Now, there are different types of budgets. Well, the 3 types of budgets for which a nurse manager typically has responsibility are operational, right, which we'll talk about first. There's also a labor budget, and there's also a capital budgets. Excuse me. Now, the components of these budgets are presented in box 18.1. So take a look at that. It provides some definitions, if you will. All right. Now, when we talk about operational budgets, it represents revenues and expenses for an operational unit, such as it can be a department or a unit or the overall organization. Now, expenses in the operational budget are those necessary to operate on a daily basis, and that can include, of course, salaries, utilities, equipment, maintenance, as well as how to maintain equipment and also supplies. All right. There's also revenues in the operational budget that are of those paid to the organization. And in other words, this is how the organization, the units, this is how we get our monies to provide care for our patients. It comes from health insurance companies, Medicare, Medicaid, patients' out-of-pocket payments, as well as some other governmental programs as well as grants. All right. Let's see, why did I write this? There was something in your book that talked about revenues that are paid to the organization from various payer sources, and I just mentioned some of these. But basically, the revenues are paying for salaries. It pays for benefits such as paid time off and health insurance. It pays for patient care supplies. And think about all these things that this revenue has to pay for. There's overhead expenses. There is utilities, administrative costs, maintenance, as well as housekeeping. All right. I don't know why I wrote that like that. All right. Now, the labor budget is virtually always the largest expense, as I mentioned to you guys earlier. You know, it's that's your largest overhead, actually. But it's the largest expense item in an operational budget for a healthcare organization because of the salaries for nurses, other professional staff such as pharmacists, physical therapists, occupational therapists, also for staff support or support staff such as your nursing assistant, techs, unit secretaries, transportation staff, and these compose of the greatest percentage of expenses in a budget. Again, these salaries that must be paid out. Now, the labor budget is also used to provide managers with a productivity metric, which is the amount of work produced. All right. So hours of nursing, in other words, hours of nursing care per day. And again, so this is produced by a specific amount of input or resources. Again, for example, nursing nursing hours worked or that were required. Now, the productivity metric is necessary to give managers a measurement of the number of nursing hours worked in comparison with the amount of patient care that is provided. So low productivity, and this means basically high nursing hours worked with a low patient census. And this is not desirable because it means higher staff salaries combined with lower revenues for patient care services. If you don't have the census, then you're not generating the revenue, but you're still paying these high salaries. And so that is something they do not like. And that was the example I pretty much gave you about the nurse manager calling at 4 o'clock in the morning, wanting to know, hey, how many people are working? What does the acuity system say? And they will ring them out, let me tell you. Now, when we talk about high productivity, this basically means a high patient census with low nursing hours. And it means that there are fewer staff to take care of more patients. So the unit may not be able, so in this case, when the census is high, and especially when the acuity levels are really high, then you're not going to have enough nurses to provide a safe quality care. And so that places the organization at risk, as well as, of course, the nurses as well. Now, most healthcare organizations have a recommended productivity measure that allows for a balance between financial efficiency and quality and safety of patient care. I know we use the acuity system to determine what our staffing needs were. Now, to achieve this balance, nurses must be at the table, the round table, if you will, during budget planning to ensure that patient quality and safety are discussed, along with productivity and financial efficiency. You know, when you get these people there at the table who all they know is the financial aspects of it, it doesn't give a true reality of what what is truly required at the bedside. And so this is when the nurses come in and we can provide our perspective and, hopefully our patients will get what the care that they need, the safe care, quality care that is needed. Now, one of the primary difficulties encountered in managing the labor budget is accurately predicting future staffing needs. And that's just a bear, because budgets are based on a predicted amount of services, the patient census. Well, sometimes the census is high, sometimes it's low. You just don't know. The only time I can say that a census were ever predicted with perhaps 100% accuracy is during COVID. And you all know that. I mean, they barely had any beds, right? So, so it is predicted on amount of services such as the patient census, variances between actual staffing levels and budget levels occur if the facility experiences an unanticipated increase or decrease in patient services. And so again, sometimes just really difficult to predict. Now, another concern related to the budget and labor expenses balancing the patient acuity, how sick they are, or the degree of patient illness with the nurse to patient ratio. And again, this is what this acuity system or tool is supposed to be used for. It is supposed to, for example, if the acuity tool, if it scores patient severity from 1 to 6, 1 being the least severity and 6 being the most severe, then you would hope at least that if a patient is at number 6, then it would mean a 1-to-1 patient ratio. All right, which would likely be in an ICU. Patient may have a ventilator, a balloon pump, and all kinds of drips, and the patient is just very ill. All right, and so again, it's just very difficult to determine when this would be required. Now, as far as capital budget represents funds allocated for construction projects. So when you think about capital, think about construction projects. This is not per se patient care by any means, but this is renovations and those kinds of things. Construction, maybe constructing a new chest pain unit. It also involves major equipment purchases, for example, a cardiac monitor or a defibrillator, even computers and what have you. And this is typically referred to as capital expenditures. This is what we're spending this particular monies that is budgeted for these items. Now, the capital budget is developed separately from the operating budget because payments for capital purchases spread out over multiple years. And so for example, for a defibrillator, you're going to get multiple uses out of this device probably over the next 5 years. And so that monies can be spread out. All right. This is not something that will be considered within the 1 year, right, operating budget, but it is more spread out over a number of years because these types of technology, they last for a pretty good period of time. And so, again, it's not something that we have to pay for within a year, if you will. Now, the capital, or rather the main requirements for a purchase or acquisition to be considered as part of the capital budget is that it has a useful life expectancy of more than 1 year. All right. And it costs more than a minimum dollar amount established by the organization. That could be between $500 to about $2,000. You take like a blood pressure machine. You may have this machine for 5 years, right? And it may cost, just to make it easy, it may cost, let's say $5,000. Meaning, so every year, if you're paying $1,000, right? But this device is giving you that type of a service and whatnot. Now, the term capital simply refers to The funds are used to purchase long-term investments, such as major medical equipment, computer systems, and also newly constructed buildings, units, and what have you. All right. Now, a capital budget item is an expensive purchase that will be used by the organization for many years to come. Capital budget items are often referred to as capital assets, right? Or they are called long-term investments, capital investments, or they're called capital acquisitions. So those are some of the different terms. Now, these capital assets are treated differently from the operating budget expense because of their multi-year value. They have a multi-year value, and so we're not looking at it again from over a year, but over years. All right. Now, because capital purchases are often considered investments, they're going to be scrutinized more carefully during the budgeting process. All right. Now, planning capital budget requests it truly tests the nurse manager's long-range planning skills. All right. The nurse manager must be able to look 1 year to several years into the future to identify capital budgeting needs and to bring those needs to the attention of senior management, of course, for approval. The unit or department need for a capital purchase must be weighed against the financial implications for the organization's entire capital budget. Now, the nurse manager, along with input from his or her staff, has a critical role in helping to plan the capital budget and also to justify the priorities, and also to ensure that the needs of the facility and the patients are met. All right. So part of the nurse manager's job will be to justify, to explain to upper leadership, management, why a certain technology is required. And of course, when you start talking about safe and effective patient care, ears perk up. All right, because you don't want to, you don't want to be sued as an organization or involved in any kind of litigation, if you will. All right. Now, there is a kind of budgeting referred to as incremental budgeting. There are two basic methods for budgeting. It is the incremental approach as well as the zero approach. Now, both approaches have particular strengths and weaknesses, and both are completely sound approaches in most situations. But I will tell you the incremental approach is more common. It is the most common method that is used primarily due to the fact that it is relatively simple and it can be applied to most circumstances. Now, the incremental approach is simply a forward trend of recent performance with adjustments for future growth or decline in revenues or expenses. All right. So, for example, in this approach, the nursing unit's budget is based on the actual cost from the previous budget period, with a small increase for planned salary increases, perhaps, and the higher cost of supplies, because as we know, the cost of just about anything continues to go up. All right. And so this is one of the reasons why the incremental budgeting is much more practical, if you will. All right. Now, the zero-based budgeting is used far less frequently than the incremental budgeting. It builds a budget from the assumption of no volume and no resources allocated. It is developed as though the budget were being prepared for the very first time. All right. Each budget cycle begins with a critical review of the budget assumptions and proposed revenues and expenditures. And as I said, this one is used much less. Now, in developing the budget, the nurse manager, this particular one, the zero-based budgeting, the nurse manager understands that whereas one nurse is necessary to care for one patient, That nurse may also be able to care for 2 or 3 other patients at the same time. Therefore, the cost of nursing salaries varies according to the volume of patients being treated in the center and the acuity of those patients. Now, this process works somewhat differently in support departments that do not provide a revenue generating service, such as patient treatment areas. Examples of departments that are necessary to support treatment and care delivery processes, but are not generating any revenue, includes, for example, nursing administration or the human resources department. These departments, they don't generate any revenue, but they are there for support of the treating areas. All right. Now, in such support departments, expenses do not vary with volume, right? And therefore, these departments base their budgets not on a variable volume of patients visits like the treatment areas do, like hospital units, but rather on a set core of expenses to run that particular department. And so those other departments, like, again, administration, human resources, are not based on a volume of patients. Although if you didn't have a volume of patients, then they wouldn't be there either eventually, right? All right. So this next one is actually a critical thinking question, but we'll go to the budget process. I think there's like maybe 6 more slides after this. All right. So budget process. Developing a budget is actually a continual process. All right. This is not a one and done, but a continual process. Organizations are constantly making projections for future budgets, implementing current budgets, and also analyzing month-to-month variances in relation to the budget. Remember, this is ongoing. All right. Now, the current budget usually covers a 12-month period, as I mentioned, which is also known as the organization's fiscal year. So when you hear fiscal year, in this particular case, it covers a 12-month period. Now, the development of the budget for the new fiscal year occurs a few months ahead of the start of the new fiscal year, so that the budget can be developed and approved at all levels before it can become effective. And so if the budget is supposed to begin in September, then you may start the process in working on it around June, maybe even sooner, depending on how large the organization is. Will determine when you start working on it. The organizations usually have a defined procedure in place for budget development. This defined procedure tells managers whether the budget development will use the incremental method, may use the zero-based method, or some other method defined by the organization. All right. Now, organizations may also define whether they use a top-down, a participatory, or iterative approach to budgeting. And you can see by looking at the term top down, in other words, the big shots, the big wigs, they're making the decisions and nobody else has any input. Versus participatory, then you know that regular staff, managers, they're all involved in that process. So, but take a look at box 18.3 and it will give you more information about those terms. Now, one key to understanding budgets is to know the unit of service on which cost and revenues are based. All right. So, in other words, patient days is the common unit of service for inpatient facilities. In other words, patient visits or visits by categories. In other words, short or intermediate or long term. And these are the units of services for ambulatory clinics and also home care agencies. Now, budgets are then developed on the basis of the unit of service predicted for a given period. Now, the unit of service may vary depending on the organization, the setting, financial policies. Therefore, it is essential that the nurse understand the unit of service in the area in which he or she is employed, be that an outpatient facility versus an inpatient facility. So that you would have to, as a manager, you would have to understand either one, wherever it applies, right? Now, the following are basic steps for developing a budget. You would want to review the strategic plan to identify goals and objectives. The budget is developed to accomplish these goals and objectives. Also, set budget assumptions on which to base budgeting decisions. You have to make some assumptions about the budget. Budget assumptions deal with issues that affect the future performance of the organization and address questions such as, are supply prices likely to increase or decrease, right? And by what percentage? These are the assumptions in which you can rest assured that, especially the environment, the financial environment we're in today, you can expect an increase in the amount that you're paying for supplies. And so that can be part of the assumption, or that the census may be, too low during this season and maybe very high in some other season, for example, in the winter. So after step 2, then you want to gather information about past results and use the information in combination with budget assumptions to set reasonable expectations about future performance. And so there is some past data that can be reviewed, as well as the well-educated assumptions that can help nurse managers and nurse leaders to predict better. Also, predict the units of service that will be provided during the budget period. If you look back on the last few years, and you've had over 100, let's say, home health care visits, then you can pretty much assume that, or there's an assumption that, yeah, well, I can budget for at least maybe 110 or something like that. We also project the expected revenues on the basis of the unit of service. What would a high census for at least 8 months out of 12, 8 months out of 12 would be expected, all right? Project expenses or rather project expenses on the basis of unit of service. So determine expenses for the labor budget first, because you got to pay people, right? Based on the predicted units of service and the number of full-time equivalents, which we refer to as FTEs. And you will hear that term when you get in the clinical setting as well. Full-time equivalents, those are just full-time workers. And so basically, this is going to be based on the predicted unit of service and the number of full-time equivalents needed to provide that predicted service volume. So each full-time employee is considered one FTE, or is 280 hours per year, 40 hours per week. And so there's just a way to calculate all that. So I wouldn't worry so much about it, but just be aware of the fact that this is how this is predicted. All right. And then we get into the variance analysis and what this means. Variance analysis, I thought I talked about this earlier, but it is the process by which deviations from budgeted amounts are examined by comparison of actual performance results, what is actually happening now, versus what was expected or budgeted for as far as our future, if you will. And so that is the definition of variance analysis. All right. Now, one primary use of a budget is to evaluate the financial progress of the department or the unit. Through this process, variances are evaluated on a quantitative and qualitative basis. And just think about those two concepts: quantitative, more like numbers and what have you, and qualitative, more like telling a story. All right. Now, quantitative analysis focuses on numerical variances to the budget, as I just mentioned. All right. So, in other words, are you over or under budget for labor, employee salaries, supply usage, or revenues generated? All right. Now, also take a look at table 18.1 for a sample budget and variance report. It's pretty lengthy, so you would just want to kind of just, kind of peruse it a bit. All right. Now, qualitative analysis of budget variances focuses on explaining how the current conditions in the clinical unit impact the budget that was previously developed. So you're telling a story about this, right? About these happenings, if you will, these occurrences. Now, often the daily operations for a department or unit changes in ways that make the actual budget expenses and revenues different than what was originally planned in the budget. All right. So, for example, a unit may be budgeted for nurse staffing at 5 hours per patient day, based on a given patient acuity level. All right. Then the hospital's admission patterns change, and a large number of patients with significantly higher acuity levels are admitted to this unit. Now, the nurse staffing increases to from 5 to 7 hours per day based on the new acuity level. Now, this sort of qualitative change can make budgets difficult, if not impossible, to adhere to without modifications. Now, nurse leaders in the clinical department or unit are best positioned to determine why variances have occurred, because variances are almost always related to a clinical issue, such as the one just described. You have this increase in the amount of severely ill patients. All right. Now, variance information is presented by means of certain standard reports. There are a certain way that this has to be prepared and presented. Now, through such reports, nurse managers are able to compare the budgeted amounts for expense items such as nurse salaries and patient supplies with what was actually spent for the items. Now, from there, the nurse manager can consider what is occurring in the clinical setting to explain the variances in budgeted and actual expenditures. And so there's a report where this must be made. All right. Now, there are some cost concepts to talk about. When considering the budget, one must have a basic understanding of how much healthcare services cost and how to predict changes in cost. Right. So consider this question: how much does it cost to provide nursing care to one patient for one 12-hour shift? All right. And unfortunately, the answer is not simple, because many factors affect how much something is going to cost. And so, for example, think about, you are taking care of a patient with acuity level of a 1 versus someone with an acuity level of a 6. Or if that one's health began to deteriorate and they are now a 1, right? They went into maybe pulmonary edema. Now they're intubated, and now they have all these drips, and then they have to be taken to the ICU and so forth. And so it's just very difficult to predict. All right. Things do change. All right. Now, an important step to understanding cost is to review the primary types of costs that accountants consider when determining the cost of services in a healthcare setting. And they are as follows. And what I would want you to do is to take a look at page 329. All right. And I am providing, of course, some of the abbreviated portions of this here, but on page 329, it gives you a more comprehensive view. I'll go through maybe a few of them. So, for example, where it talks about service unit or unit of service, and this is the basic measure of the product or service being produced. All right. The unit of service varies with the healthcare setting and type of service being provided. So examples include patient days at the hospital, home care visits or home care agency, right? Patient visits, for example, an outpatient clinic, an operating room time, and this is, for example, an outpatient surgical center. And then, of course, another one of the concepts is direct cost, costs that can be traced directly to the production of the unit of service. Examples include nursing care and supplies to provide direct patient care. The important concept to remember about direct costs is that they vary with the volume of services. As the patient census rises, the need for additional nursing care and supplies will increase. All right. And then there's indirect costs that are incurred as a result of the organization's operating expenses, but are not directly related to providing the unit of service. Examples include salaries for administrative personnel, remember the accountant, the administrators, or the human resources department. Also expenses for security, right? Because you have to have security. There's housekeeping, utilities, and building maintenance. Indirect costs are sometimes referred to as overhead, right? And I'll just read one more. The other one is full cost. This is the total of all costs associated with a unit of service. It includes direct as well as indirect costs. It's full costs, both. All right. And you can go ahead and read the one on fixed costs as well as variable costs. I don't want to be too long, keep you on here too long. All right. So nurses are key to enhancing the value of healthcare. As we know, today's nurses face challenging situations given the nursing shortage, the strong focus on cost reductions, while also improving quality, and the increasing acuity of patients in all settings, from hospitals to home care agencies to nursing homes. The acuity levels are just increasing. People are just sicker. Now, at the same time, the organizational leaders are faced with challenging economic times, with declining reimbursements that are tied to quality metrics and increasing costs in all areas, including salaries as well as supplies. With respect to the declining reimbursement, where it talks about tied to quality, so basically insurance companies expect that when patients come into the hospital that that the care that they receive is so excellent that there will not be any complications or issues and whatnot. And so, for example, a patient comes in with a Foley catheter, or rather a Foley catheter is inserted, and you leave it in there too long, and patient develops a catheter-associated infection, right? And the insurance companies are not going to pay for that. There's also something in place by Medicare in particular. It is some of you who work in the hospital may have heard of this. It is the sepsis protocol. And when someone comes in with suspected sepsis, there's certain procedures that must be done within the first hour. I think it's like drawing blood gases, drawing blood cultures, giving antibiotics, giving IV fluids, and so forth. And if that is not done, right, then hospitals, they receive a reduction in their reimbursement. So all this is tied to quality metrics and what have you. All right. Now, changes to improve quality and reduce costs must be made, of course. So what tools can nurses use to make a difference and lower cost? Right. So in one example, a team of nurses in a large healthcare system, they implemented a video monitoring system, uh, to reduce patient falls while also reducing the cost of paying sitters to be with the patients. And I forget what they call these machines, but basically, we used to have to hire home care agencies or even use our own staff, take them away from the floors and put them in a room with a patient who may be on suicide precautions or who are at high risk of injuring themselves. And so basically the book, this is just talking about this team of nurses. They wanted to reduce their overhead, reduce the amount of monies they're paying someone to sit for the patient, but use this technology to constantly watch the patient. And sometimes they have like this central unit who watches, let's say maybe 10 rooms, and they can call the floor and say, hey, Mr. So-and-so is trying to get up out of bed. Someone needs to go in there. And so, in other words, one individual is watching 10 patients on a video monitor. And so that's what that's talking about. And these are just ways that staff has come up with how to save the organization or the unit in particular more monies. All right. Take a look at also box 18.5, page 332. It summarizes key tools that are components of professional nursing practice and can be used to significantly lower costs and improve the quality of healthcare. So take a look at that. You never know what kind of ideas you all may come up with, and that may be employed on your unit. So, folks, that is about it. These are some of them as well, by the way. For example, promote the use of evidence-based practice to ensure the most cost-effective care is provided in this right setting at the right time. And so, we're all about using evidence-based, strong science to provide or deliver care to our patients. Ensure patients and families are fully informed about options and care decisions and have a voice in decisions. And so just take a look at, again, box 18.5. I think that's about it, folks. And I'm going to cut off right here as it is 1:49 in the morning. Thank you all.